Welcome to Love and Guilt in the Anthropocene, a podcast to help people and organizations embrace the adventure of climate action. We are envisioning a world where sustainability comes naturally. Welcome back. This is an episode where we're reading from the blog, and this particular blog entry is called OR Trash Talk, Reusable Items and Waste Sorting Practices, the Drama of Your Hospital's Garbage. In an earlier blog post, I talked about finding batteries in medical trash during our waste audits. Of course, batteries aren't the only notable thing in medical waste receptacles that shouldn't be there. I've seen lots of interesting things in the trash, starting with my very first foray through surgical waste in 2012. But one element that surprised me were the reusable supplies that were accidentally thrown away. Never having been in an operating room before, I assumed all medical supplies were somewhat sacred, or at least well managed. After all, they seemed so important, sterile things flown from around the world to be present at the very moment a patient needed this procedure. But the reality is a little less reverent. In those first waste audits I conducted as a graduate student, we dug through the trash from 65 hysterectomies, and we found reusable items in 3 of those cases. Each item was a simple stainless steel supply, a little cup or a kind of forceps, but they were small and got lost in a sea of disposable blue plastic draping. Our clinical advisor, Noe Woods, informed us that these were, in fact, reusable items, improperly thrown out, and cumulatively, they likely cost the hospital about $30,000 to purchase. For some reason, officially designated reusable items are really expensive. Our work was paying off, literally. Improper sorting of medical waste causes not just financial issues, but health and safety issues too. But we haven't exactly made the system easy for people to navigate. There are lots of different waste streams in hospitals and operating rooms: regular white bag trash, hazardous red bag trash, sharps bins, black bins for hazardous pharmaceuticals, linens bags, chemo or pathogenic bins, reprocessing bins, etc. I usually get overwhelmed with the typical binary trash or recycling bins set up in my office space. It's a lot of mental load to properly sort waste. But add 10 times more waste streams to the mix and put them all in a place where time is money. I don't know how OR staff can do it. The truth is, it's hard, and they don't always get it right. I've seen improper sorting in every single waste audit I've ever conducted in the US and abroad. One of the most basic safety sorting protocols in healthcare is the sharps container. Sharps are blades or needles or anything that could stick a person. It makes sense to keep those separate from everything else and to store them in hard, impenetrable containers. But they don't always end up there. My study team found sharps where they don't belong in 2 different US-based waste audits. Private health information, protected by HIPAA and sometimes printed out on forms in clinical spaces, needs to be shredded. But even that, we found, disposed in wrong spots, like unshredded papers with patient info ending up in normal landfill trash. These examples are for waste streams where the definitions of what qualifies are pretty clear. Red bag or hazardous solid waste has a huge range of possible definitions from state to state and institution to institution. At a medical conference, I once pulled the room of about 70 attendees to ask what they thought red bag waste was. "Anything with the drop of blood on it," said one attendee. And I've even seen more conservative interpretations. Anything in the OR where a patient had surgery, even if it was a cataract surgery with very low quantities of potentially infectious fluids. "That's ridiculous," said another attendee. "At our institution, it's anything soaked in blood. You have to be able to wring it out, and if it's dried, it doesn't count." That's a pretty wide range, and it's made even more confusing when we think of exceptions to this rule. Menstrual products. They're so ubiquitous in bathrooms around the US that no one considers them truly hazardous in the same way medical waste with other blood is. There is an infectious risk from these wastes, but it seems we're not really sure what that risk is. The broad interpretation suggests we could use some more studies to help us determine what risk management steps we should take, because there's a balance to maintain. Sharps and bodily fluids can spread disease, and it's more likely to spread to people who have the hard jobs of handling waste. But if we treat everything as extremely hazardous, we pay more for it, driving up the cost of care, and it requires more treatment steps that result in more environmental emissions, including incineration, which, for medical plastics, releases dioxins and other known carcinogens. That's kind of counter to doctors' do no harm oath. The more I learn about healthcare, the more I view its garbage as a symptom of bigger problems. Reusable items accidentally thrown away may not seem like much, even given their ridiculous price tag. But this proliferation of the number of supplies used and the lack of general respect or accounting for supplies is part of the reason people still get sewn up with towels or other items accidentally left behind. This kind of accident still happens today. I had a college friend who fell horribly ill after giving birth to her second child via C-section, and sure enough, they left a towel in her abdomen. Of course, providers and suppliers alike are trying to address this particular risk. When observing orthopedic surgeries, I watch the staff count every reusable item in every tray at the beginning of the case, and again at the end. It sounds like a reasonable request until you see that each orthopedic surgery uses about 7 75-pound instrument trays. Not every instrument is used, but you still have to count them all twice. Similarly, companies have developed disposable needle counters where used needles can be stuck in and visually accounted for before being chucked all together in the sharps bin. Other manufacturers are making products like gauze with a little thread woven in that's detectable on x-rays, just in case. But I wonder if more products are really what we need in these spaces. Lean and Six Sigma approaches, used initially in automobile manufacturing, can be applied in this space to help remove some human error and make it easier to properly manage these supplies. Given what I've seen in the trash, an important first step is optimization of supplies. Only bring in what you need, followed by standardization, all surgeons and teams using the same supplies as much as possible, which Lean and Six Sigma are also good for. Garbage isn't usually what most people consider sexy, but it holds some pretty intense and sometimes dirty secrets. It's a great tool for health systems working on sustainability or just trying to improve the quality and value of the care they provide.
Thank you for listening. If you want to embrace the adventure of climate action, subscribe to our podcast and check out our Love and Guilt in the Anthropocene blog at clinicallysustainable.substack.com.